The role of collagen. We discussed about the bone and we saw how the bone is that strong. Okay, sure, it's very, very resilient because it has this hydroxyapatite structure, this hydroxyapatite crystal. Of course, the hydroxyapatite is the strongest molecule in our body, but this is not enough. If you have something very, very strong, typically all the structures that are very, very strong are fragile. They're easy to break. They can be strong, but they can be easy to break. How does the human body overpass and surpass this obstacle that is just of hard structures? So our human body does this, that because it has the collagen and because the collagen is tightly arranged in parallel form, this allows the bone to become also flexible. So it's not just that it can resist this high mechanical pressures, but because of the parallelity of the collagen and as a consequence the parallelity of the hydroxyapatite, this is what makes the bone both flexible enough not to break and strong enough because of its high content in hydroxyapatite. This is also why in the bone we will see acidophilic colors. Now, as we saw generally in the staining procedures and in the whole histology slide preparation, we saw that we have molecules that decalcify. We have find, for example, EDTA, this typical decalcification structure, not enzyme, this decalcification molecule, let's call it. So EDTA, whenever it's added in the slides, in the slide preparation phase, of course, this is done every time for hard structures, for tooth, for bone, for many other hard structures. So we have first a decalcification because you cannot cut the bone in very, very nice thin sections, to see it and to visualize it with hematoxylin and eosin. There are some special staining methods that we use for bone, but typically we use hematoxylin and eosin, depending of course on what we want to focus on. So in our sections, in the sections that you see both in the department and of course in the histologyguide.com, you will see that the color of the bone within the hematoxylin and eosin staining is going to be acidophilic. It's going to be pink, not basic. Of course, this is not because the bone is basic. Of course not because the bone is acidic. Of course not. The bone contains high amounts of calcium, making it typically basophilic. But because we have this decalcification process, we're going to see this acidophilia. And this acidophilia is because of the high amount of collagen that is within the bone structure. So let's move on to periosteum. We discussed last time in the cartilage lecture about the perichondrium. The thing is that these two structures are practically identical. They both have the two layers, the stratum fibrosum on top and the stratum in the cartilage. It was chondrogenicum. Here we call it osteogenicum. Chondrogenicum is for the word that actually means chondro, cartilage, and genicum, to produce. Again, this here the osteo because it produces bone, of course. I mean, we have exactly the same typical features. Again, the upper part contains fibroblast, collagen, and again the similar features. And the second part, the stratum osteogenicum, actually contains mesenchymal stem cells, cells that will eventually become, in the cartilage cases, they're going to become chondroblasts, and here they're going to become osteoblasts. There is one major difference though, and it's the attachment and the adhesion of the perichondrium to the cartilage is not that tight. Here it is in the bone. The periosteum is very, very tightly connected to the bone, and this is because we find these unique fibers. These fibers of, again, they're called Sharpey's fibers. These Sharpey's fibers are again collagen, nothing excessive, nothing extreme, but there is one unique feature, that these Sharpey's fibers are attached within the hard structure of the bone. So we have the periosteum that has the soft collagen as it is, but this collagen attaches the periosteum directly within the bone within the bone. So these are called the perforating fibers. Second name is Sharpey's fibers. So the perforating fibers, Sharpey's fibers, attach the periosteum, which is loosely attached to the periosteum, with the very, very tightly attached within the bone in the lamellae. We'll discuss what the lamellae are. So far we've discussed all of the cells of the bone, what makes the bone. We've discussed of the three different types, the osteoblast, osteocytes, osteoclasts. We discussed about the continuous rate of both bone production and bone destruction. We discussed also about how this, where these osteoblasts and where these cells come from. Of course, the osteoblasts come from the mesenchymal stem cells of the periosteum. So of course, the function of the periosteum is not just to attach and to stay above the bone, but it's also the source of these cells, the source of osteoblasts and the source of osteocytes. So if you have a faulty or malfunctional periosteum, you cannot have the regeneration, the production of bone. So this is just the basics of bone. Let's see the different types of bone within the human body. This classification is not, of course, for anatomy. This is not in the short bones, long bones, there's the types of the bones. Here in this case we discuss about the histological classification, meaning that here we focus on the characteristics in the contents when it comes to the cell, direction of the collagen, and general structure of this bone. So we have the two major categories, immature bone and mature bone, or otherwise called woven bone and lamellar bone. So the differences between these two structures, we'll discuss them individually, of course, one by one, but in very short and in very few words, it's about the strength and the direction of collagen fibers. Of course, the woven bone is weaker than the mature bone, but it can be formed faster. The lamellar bone is way stronger than the immature, but the mature bone takes longer to form. And of course, we first need to go through the woven phase and then to reach the lamellar. In other words, we discussed in the previous practical that the first structure of the human body for the bones is the cartilage. So first we have cartilage in most of the body, in most of the bones of the long bones specifically. First we have the cartilage, which eventually is going to be transformed into immature bone, and this immature bone in time will start to harden and become the mature bone that we have in our bodies as adults. So we'll discuss, of course, this process of how cartilage goes into bone. This is the process of ossification. This is the topic of our next practical. So at this point, let's just focus on the immature and lamellar bone. So let's start talking about the mature, then we'll discuss the subcategories of the lamellar bone. As I was saying before, the woven bone, the immature bone, of course, contains type 1 collagen, as the same as the lamellar, but this case here, the case of the immature bone, is that it actually contains randomly placed, randomly arranged collagen type 1. That's why it's less strong and less flexible, because of the irregular deposition of collagen type 1. This bone, of course, this type of bone, the immature bone, just because it's faster to produce, this is why the first structure to be formed after destruction of a bone, after a fracture, after any sort of pathology of the bone, the first step of the human body is to produce immature bone, which will eventually differentiate and mature into lamellar. Immature bone has lower amount of hydroxyapatite than the mature bone. This is one more feature. One more feature is also that it contains more osteocytes, meaning that it has more cells and less minerals. And this is why it's faster, it's formed faster, but it's also weaker because it has more cells and less loosely arranged and irregularly arranged collagen type 1 fibers and less minerals within it. Let's see some pictures of how this actually looks like. So here we have the immature bone. We simply see a numerous population of osteocytes within the immature bone, and we see again the same exact structure after maturation. Here we see a much more organized structure. We see the lamellae. We'll discuss what the lamellae are in a bit. But in this case, we can see the very neat and very structured direction of the collagen type 1 fibers along with the osteocytes. This is the histological picture of the woven bone and the lamellar bone. One of the easiest features, one of the easiest things to do and to see, to identify whether this is woven or lamellar, is the amount of cells. Here, for example, you can see this is the distinction point. The woven is right here. You can count the density of the cells is much higher than the density of the cells in the lamellar right here. Again, more pictures to it exactly to just punch this point in. Here again, this is woven bone, many cells, no specific concentric aggregations, and here we have very tightly, very neatly organized both cells and collagen type fibers, collagen type 1 fibers. Now, let's focus on the lamellar bone. Let's see what actually makes the lamellar bone what it is. In fact, there are two subcategories of lamellar bone. The cortical bone, the cortex, this is the cortex, always in an organ. The outer part is the cortex and the inner part is the medulla. So the cortex of the bone is called also compact bone or cortical bone, both terms work. And the inner is either called, the inner part, the medulla, is either called trabecular bone or spongy bone. Spongy is of course because of the appearance and the morphology of the bone. It looks like a sponge indeed. There are many hollow spaces. And within these hollow spaces we will find the bone marrow. So the compact bone, even just from location, even because you can actually, it's on the periphery on the bone and not within, inside the bone, it's an actually much harder structure than the spongy bone. Of course, spongy bone is still very resilient, but it's not as hard as the compact bone. The density of the density of the minerals in the cortical bone is much higher than the density of the minerals within the spongy. Here we see two very typical features, typical pictures of how this looks like. The compact bone is as this structure. We'll discuss of how this is structured. This is the osteons. We'll see it in just 1 second. And the trabecular are simply islands of bone. Again, we find the similar structures, collagen type 1 and osteocytes within this. So let's zoom in and start discussing of how this cortical bone is formed, and then we'll discuss what actually the trabecular bone looks like in the microscope and what cells it has. So the cortical bone is practically made out of these units. The bone, these units, the organizing units of the cortical bone are called osteons or Haversian systems. So how does this osteon look like? The structure is this cylindrical tube-like structure that has concentric lamellae. These circles are called lamellae. Of course, the lamellae are nothing more than just, again, high amount of collagen type 1, again, hydroxyapatite, and of course osteocytes within. The cells are exactly the same. The cells in both trabecular and lamellar bone are exactly identical. There is no difference. There are different forms, we'll see what, but they're exactly the same cells. So we have these tube-like structures that are called osteons. These osteons are practically concentric lamellae that contain the osteocytes and the hard tissue of the bone. Within this, in the center, we have the central canal. The central canal practically bears and brings vessels and nerves. This is where all the bone tissue receives nourishment. If you have, of course, no vessel, no blood supply, you cannot have a vital structure. So the cortical bone is, of course, vascularized. It's a vascularized structure. These veins, arteries, and nerves pass throughout the central canal. As you can see, this is a section of the central canal. The blood vessels come, of course, from outside the bone, penetrate the periosteum, and after they penetrate the periosteum, also have to penetrate the bone, the compact bone. This canal, this is called the Volkmann canal or perforating canal. The name is cut out here. So there's perforating canal and the central canal. The perforating canal practically allows penetration from outside the bone to within, to the center of the bone, and penetrating, of course, the whole thickness of the bone. And the central canal practically allows these nutrients to be diffused throughout the whole structure of the osteon. So again, this is a nice picture of the nice animation of the osteocyte. We can see again these canaliculi. The canaliculi are again the cytoplasmic process of the osteocytes, and the lacunae is where this osteocyte resides. So all these osteons are practically the units that form the compact bone. These osteons are continuously being produced and continuously destroyed. So the original, there is a picture here, where is it? There we go. Before we go to this picture, again, this is the same per se summation, a sum up of what I just said. Again, we have the Volksman canal, which is the one that penetrates from the periosteum to within the bone, center canal, the lamellae, center canals, external, and we'll discuss about the lamella right now. What does this mean? What does this lamella mean? What is it actually made of, and the external and internal? One common characteristic within all osteons and all of the locations is that there is always one, the last lamella, let's say, the last lamella that surrounds the osteon, which is this is the osteon, let's say in an animation, is a cross section. The last one has what the structure that is called cement. Practically, this is nothing more than aggregated collagen type 1. Again, just a simply higher amount of collagen within this last lamella. So, how do we have this very peculiar structure? Because if you take notice, you can see that it's not just the osteons. Here, in between the osteons, we have other structures. We also have the external lamellae and the internal lamellae. And in between the osteons, there has to be, there is pre-existing bone. How is this formed? This practically leads us to the question of how is the compact bone completely formed? This happens because we have continuous production of osteons. This is the unit that produces the osteons itself. It's nothing more than just 3 different cells. The osteoclasts that destroy the old bone. This is the endothelial cells that bring the vessels, and the osteoblasts in the lower part of the tube. So the top part practically destroys the pre-existing bone. The lines parallelly, the peripheral lines here, are the ones that bring the osteoblasts, which will produce the bone in this concentric arrangement. And in the center we have the endothelium, which actually will become the vessel, which is the vessel. So imagine nothing more than just a tube that inside, in the inner part of the tube, it contains the blood vessels and of course the nerves. The upper part contains the cutting edge, because that's how it's also called, because it contains the osteoclasts, which destroy the pre-existing bone. And the sides beneath the top contain the osteoblast that will produce eventually the new osteon. So what happens is that in between this, imagine that there are many different, this is called the bone forming unit. Imagine that there are many different bone forming units. One is here, one is here. But this side in between is actually intact, it's not touched. This is because the process of the development of the osteons is not fully extends the whole thickness of the compact bone. So this picture now makes much more sense. This is the first osteons are produced. Then of course we have the remodeling, the destruction of the pre-existing to produce more and more on that and more on that. This continuous process of production of osteons, this is what leaves the remnant lamellae that are actually can be found in between these 2 lamellae. For example, here we see this one osteon, second osteon right here. This lamella right here is not of the same osteon here. This is from the pre-existing, the older osteon that was destroyed eventually. Do you see the difference? Here we have a very nice concentric shape, and here this concentricness is being lost. This is because these lamellae do not belong to this osteon right here. And these lamella that are not that do not belong to the other osteons, this is called the interstitial. Interstitial, of course, is always used when we talk about a structure that is between 2 different cells or between 2 different tissues. So here, these interstitial lamellae, this is the interstitial lamella right here, for example. This structure is again the old osteon that was destroyed, but not completely. This is remnants of the previously formed osteons. So we discussed about all of the different structures, and let's start focusing on the compact bone when it comes to the microscopical level. The structure in the department, and of course is in the histology guide, is called textus osseus. Here's where we find the true compact bone. This is the cross section, and this is the longitudinal section. So let's start first with cross section. We can see everything much better here. So again, this is where the periosteum is located, and here is a second structure called the endosteum. We'll discuss about the endosteum in a bit. After we see the endosteum is a topic better discussed with the trabecular bone in a bit. So let's first focus on the osteums and how the osteums look like under the microscopy. So let's zoom in. It's actually very easy to see these concentric structures, these concentric lamellae. So here we have the central canal, and these are the, do you see these irradiations? These irradiations, this is the sign of, this is the sign that actually confirms to us that these lamellae are practically product of this one osteum and not of the pre-existing osteum before. So here we have the central canal that brings, of course, bears the vessels, and here we start seeing the osteocytes. So this central canal is, of course, surrounded by endosteum and, of course, the endothelial cells. And here in this concentric lamellae, we're going to find the hard bone deposits and, of course, the osteocytes. This picture right here, in this section right here, we can find one osteum right here and the second osteum right here. This is the perfect example of the interstitial lamellae. Why? Because we see that this arrangement, there is no practically radiation of this, let's say, empty spaces towards the central canal. So this is what can actually confirm us that this is from a pre-existing osteum that no longer exists. So here, this is the actually active osteum right now, and the second is right here. So this is pretty much what we should discuss when it comes to the compact bone and the osteums. It has, like this is a different staining method that actually allows us to see more of the organic material and more of the in the same structure but in a different staining method, and allows us to see different features more or less. But again, this is nothing more than just a second picture of the pre-existing structure that we saw before, nothing more. This actually section right here allows us to see much better the external lamellae, the external interstitial lamellae. This is from the first part of the compact bone. Let me show you again which part. This is the external circumferential lamellae, right this. The perfect structure is seen much was here, right this. Again, this is nothing more than just lamellae of pre-existing osteums that no longer are there. So this is another picture that you can see the concentricity of the central canal and the osteum right here. Let's start talking about the cancellous bone, the spongy bone. Again, the structure is the same. Again, we find osteocytes. Again, we find osteoclasts. Here we also find one different type of cell, the bone lining cell. As we saw before in the picture of the bone forming unit, these edges on the side had osteoblasts. These osteoblasts are not always 100% fully active. After the bone is produced and there is no necessity for new bone, these cells, these cuboidal cells, become squamous-like, thinner squamous-like cells. These squamous-like cells are practically called the bone lining cells. So this is where we find them. We find them in the endosteum. The endosteum is actually, if you have a cross-section of the trabecular bone, these projections, and you cut them in a cross-section, you will see this structure. This is where you can perfectly understand how this trabecular bone is structured. On the surrounding part, we have the endosteum. The endosteum is a lining of two different cells, three in fact. The osteoclast, which destroys the bone, the osteoblast, the active osteoblast, which is more tall, cuboidal, or even in some cases low columnar. And of course, we find the very thin squamous-like cells, the bone lining cells, which are again nothing more than inactive osteoblasts. And again, we can start seeing the structure in the microscope. Again, these are the osteums, the compact bone on the other side, and in the inner part we find the trabecular bone. So let's zoom in the structure. Again, the structure is again very simple and very similar. Again, on the other part we have the endosteum. Here is the bone lining cell. This cell right here, this very thin squamous-like cell. This is the bone lining cell, which is again the inactive osteoblast. And inside we have the typical osteocytes as they were existing in the previous case in the compact bone again, and we find again the lamellae, but the lamellae are in different shape. They're simply just parallelly arranged hard deposit of the bone and collagen. This is pretty much the simple structure that we discussed right now. Within these empty spaces, this is where the bone marrow should reside in. Of course, here you have nothing because the section did not maintain and allow for the bone marrow to still exist in this place. But here is where we find these hematopoietic stem cells that produce all of the parts of the bone, and of course, much more important structures than just the hematopoietic stem cells.